Hello, everyone, and welcome. My name is Michael Hoefer, and today I'm going to be presenting our paper titled The Multiplicative Patient and the Clinical Workflow, Clinician Perspectives on Social Interfaces for Self-Tracking and Managing Bipolar Disorder. So bipolar disorder is one of the most serious mental illnesses that affects many people worldwide, characterized by extreme changes in cognitive state, extreme changes in mood. So half the time, this is from a recent study, individuals are in this steady state euthymic state. A little over a third of the time, they may find themselves depressed. 12% of the time, they're in a rising mood, known as hypomania. And then 1% of the time, they're in that extremely elevated mood, in a manic mood. Individuals can also spend time rapidly cycling across these states, even within a given day. So bipolar disorder has no known cure, therefore it must be managed throughout the course of an individual's life. And the HCI community has started to develop technologies to help individuals, especially focused on interpersonal and social rhythm therapy, helping individuals track daily rhythms in their life so they can come to understand triggers and sort of maintain a steady life throughout their long-term condition management. And so these different studies have sort of created different technologies and done various user studies with bipolar patients. And our present study drew from these studies and created 9 different wireframe designs for a self-tracking application that's largely based on the idea of relational recovery within social ecologies. So an individual does not manage bipolar disorder on their own, but rather in the context of their social support system. So the idea of this application is that individuals can track whatever is important to them, whether it's mood, sleep, social activity, physical activity, spending, whatever they like, and they can share that with both their social support system as well as their clinicians. And so in the present study, we spoke with 17 mental health professionals over Zoom, and we showed them these different wireframe designs and gathered feedback using both a red, green, yellow stoplight system, as well as gathering both verbal and written comments. We performed an inductive coding to sort of understand what are the best design implications moving forward to actually creating an application to support individuals managing bipolar disorder. So throughout this, I'm going to go through different designs. I won't go through all of them given the time, and I'm going to sort of present both the design as well as the findings at the same time and sort of weave together what we found as design considerations for this type of a system. So the first design really allows people to add and remove contacts over time. So individuals with bipolar disorder find relationships coming and going based on different stages of life. And one thing that clinicians mentioned about this is that an individual in a state of mania may actually choose to take everybody off of the application. And they may not do this if they're in a euthymic state or even a depressed state. And so we can sort of start to see this sort of a conflict between different selves. So we can think of the manic self here as disrupting this feature that the application provides of supporting this dynamic social system. This is something we'll come back to throughout the presentation, but the idea that these intra-individual cognitive states are distinct within the context of the system that supports the individual, and therefore by considering them, we can inform system design. So our next design is dealing with data sharing. So here we have data that is continuously shared. So the minute I track my mood, that data is available to maybe my clinician, my spouse, and my mom at different levels of aggregation. And this uncovered the idea of social reactivity. So reactivity is known in personal informatics. When you measure something, it changes what you're measuring. Well, here with social reactivity, if I know that my data is going to be shared with somebody, that itself may change the act of collecting that data. An example from clinicians was, let's say you're tracking I'm tracking fights with my brother, and I know that my mom is going to see how many times I fight with my brother. Well, there are many reasons why we could imagine that the individual may choose to not record every fight. And so we sort of get an issue in data collection because of this social reactivity. We think that our design 4 may mitigate this. And this is where we're saying, let's have somebody, instead of continuously sharing the data, they request data, and then that data request is modified and approved. And so what we're doing here is we're actually decoupling the process of gathering and collecting the data from the process of sharing the data. And by keeping those events independent, we think we can reduce social reactivity, because the choice to share with somebody comes later, and we're not therefore influencing the act of collection. Our next design is data commenting. And so this is after the data has been collected. Individuals' contacts can go in and actually create comments that then appear on the data visualization itself. So here we see a comment from the individual's mother as well as their clinician. One of the clinicians we spoke to brought up the idea that this could actually be very effective for when individuals are depressed. It can be helpful for them to get reminders to themselves from past states of mood. So here the individual would actually comment on their own data, creating a sort of data journal. And this is another example of sort of communication between individuals in two different states. So we see the euthymic self is providing these data comments about a time when life is pretty good. And then at a future date, these data comments facilitated by the system then support the individual in a depressed state. So here we're seeing that these systems are actually facilitating intra-individual collaboration. Design 9 are action plans. And so this is the idea where individuals can create automated triggers that occur based on changes in the data. So here, if the mood is below -2 for 1 week, then a message is immediately sent to their clinician. And so the clinicians we spoke to sort of liked how flexible and customizable this was. And again, going back to our different states, we see that we're now having collaboration across 3 different states, where the euthymic self is creating these action plans that go into effect at a time in the future, and they provide benefit to an individual in a state of mania or in a state of depression. So again, this is another way that the system is kind of facilitating intra-individual collaboration. Design 8 is co-tracking. And so this is where we're actually allowing a close contact to track data on behalf of the individual with bipolar disorder. So here the spouse is a co-tracker for mood. And then we're actually seeing that in our data visualization, the 2 different data streams are overlaid on top of each other. So we can see who is tracking on certain days, and on some days they both might track, which clinicians actually really appreciated, because it would allow them to sort of get some context outside of the treatment setting, and learn how things are actually ebbing and flowing in the real world. Now, another clinician we spoke to was a little bit hesitant about this, saying that I think there's a lot to this idea of letting someone else manage your mood and track your mood. In the psychology literature, there's this idea of within a partnership, you have a complex emotional system where perceptions of other people's emotions impact your own emotions. And so there's still significant future work needed to be done to understand if co-tracking can be an effective intervention to help stabilize mood, both in the context of serious mental illness as well as life in general. So I want to close with a couple generalizations to all wellness apps. We've got 3 main points here. So the first is that these intra-individual roles in a system can really support collaboration across the selves. And we know that in everyday life, we're always entering different states of mood. And so systems can actually consider each of those mood states separately and design different roles within the system to enable collaboration across these selves. Secondly, we uncovered social reactivity. And so in personal informatics in general, if data is being shared, we would expect that sharing of the data would impact the collection of the data, and we can potentially design around that in some ways. And I'd also encourage you to check out the paper, as there are over 35 other design considerations that we didn't have time to mention today. Lastly, I want to thank my colleagues and co-authors, as well as the Crown Institute, for providing some seed funding for this project.